Hey mamas, so when you are preparing for a birth at a hospital, a lot of focus is on the labor and delivering your baby part, which is very important, don't get me wrong. But there's this whole aftercare that you receive for your newborn baby that I feel like is equally important to be aware of and prepare for. So in this video, I'm going to be sharing with you the newborn after birth care that hospitals usually do for babies. If you are new to my channel, don't forget to subscribe and hit that little bell so you don't miss any of my other videos. I'm Bridget and I'm a doula in the San Francisco Bay Area, and I love helping moms love their birth. So if you've given birth at a hospital, they're going to have a list of things that they're going to provide for newborn care after birth. One of the things that they are going to do is check baby's weight and then measure their length. And that's just one of their routine things that they do just to make sure that they have that information on how big that baby was, how long that baby was. And honestly, that's like information that we love to know once our baby is born so that we can share that with our family and friends and everyone we're telling about the birth to. Another thing that they're going to do after baby is born is perform an Apgar test on them. And basically the Apgar test is just a way of measuring how well baby is doing after they've been born. Apgar is a mnemonic that nurses are going to use that are going to help them check how baby is doing after birth. So A stands for appearance, and usually a baby is going to be mostly pink with blue feet and hands where there's poor circulation. And so that's where they are going to be checking A, appearance. P stands for pulse, and obviously that's where they're going to be checking baby's heart, making sure that it's at a healthy range of beats, so that they can make sure that baby is functioning properly outside of the womb. G stands for grimace, and basically that's baby's reflex or their irritability. So, if they're being rubbed, if they're, pulling away because they don't like that, or they're, showing that grimace on their face, their irritability. So nurses are going to check their grimace, G, a part of the Apgar. A stands for activity, and that is just like their muscle tone. So when they extend baby's legs, their arms, does baby come back in a flexed position, or does baby just kind of stay limp? They want to see lots of activity with legs moving, arms moving, or, if they're pulled out, that they're going to bring them up to that flexed position. So they're going to be checking for that muscle tone or for that activity that baby shows after they're born. Last one is R, and R stands for respiration, and that's just how baby is breathing. Is baby breathing and crying well, or do they need to do a little bit of suction to help them breathe and to help them get out that loud cry, or is baby not breathing at all? And so basically this Apgar test that they're doing, they're going to take one at 1 minute, and then they're going to take it at 5 minutes again to assess how baby is doing during those initial moments after birth. Another routine newborn care that they'll do is the vitamin K injection. The vitamin K injection really just helps babies with blood clotting. They do not have that store of vitamin K. They get that at around 6 months. And so vitamin K just really helps prevent baby from internal bleeding, like a brain hemorrhage, so that, obviously baby is safe. So getting that vitamin K injection is mandatory at most hospitals. So check in with your care provider if you have questions about that, or if you're on the fence about getting it or not. Another routine thing that they'll give to babies is an eye ointment called erythromycin. And what this is doing is protecting baby's eyes against infection, especially if they have been born from their mom who has gonorrhea or chlamydia. And these infections can potentially cause blindness. Now, if you do not have gonorrhea or chlamydia, then this is not a big concern for you. And so, you can forego these things, but definitely talk to your care provider about whether or not you do want this or don't want this, and to make the decision that's best for you and your baby. If you do decide to get the erythromycin, it's important to realize that it is an antibiotic, and a lot of times what happens is that they put all this like goop on their eyes, and as it warms up, it goes down and gets into their mouth, which you want to try to avoid because it is an antibiotic, which means if it gets into the gut, it's going to kill off that good flora, that good bacteria that baby is building from licking your chest or getting from your breast milk. And so it's important to try to avoid getting it in their mouth, whether it's just, cleansing the area every so often and making sure it's not streaming down their face. So yeah, be aware of that if you do decide to get the erythromycin. So once your baby is born, another thing care providers often like to do is give them a hepatitis B vaccine. What does the hepatitis B vaccine do? It protects us against if you're using dirty needles, if you're having, unsafe sex, or if you come into contact with someone else's blood who has hepatitis B. So that's what that vaccine protects against. Now, if you're thinking, okay, but my baby isn't having unsafe sex, they're not using, dirty needles, and I'm not going to be letting them around anyone's blood, then you might be wondering if this vaccine is for you at this point. So studies are showing that even babies who do get this hepatitis B vaccine aren't protected later on in life, that they do need this booster shot. Because the idea behind the hepatitis B vaccine is that if they get it once when they're baby, that it'll protect them later on in life. But the truth is that it's showing that if you even have hepatitis B in your system, that vaccine isn't actually protecting them against that unless they get that booster shot. So if it's something that you are wondering if you should forego for now and maybe do it later on, definitely do your research and talk to your care provider about it and make that decision. Again, that's best for you and for your baby. Another routine test that they're going to do is the PICU test or the PKU test. And basically what that entails is that they'll prick the bottom of your baby's heel so that they can get a little blood sample so that they can do some screening for genetic disorders. At most hospitals, this test is mandatory, so you have to do it for your baby. But it's important that they do it after, 24 hours of breastfeeding has been established, so that there's something in their system called phenylalanine that's going to help them read and pick up those screenings from the PICU test. So another part of routine newborn care that hospitals are going to offer you is a first bath. Now, the WHO, the World Health Organization, is actually recommending that newborns wait 24 hours after they're born to get their first bath. And so hospitals are moving farther and farther away from giving babies their first bath right away after birth for various reasons. One, because it hinders their ability to regulate their temperature as opposed to being put on mom's chest and being able for mom to warm baby up. And two, because that vernix that covers them after they leave the womb is actually a protectant that keeps infections like group B strep or E. coli and other pathogens that they are introduced to after leaving the womb. It is like a force field. It protects baby against those things. So keeping that on them for those first 24 hours at least is recommended. And so if your hospital is still doing those routine baths after birth, maybe check in with them about that and decide if that's right for you and your baby. If you do decide to have your baby bathed at the hospital, I really recommend bringing your own soaps to the hospital so that they can use them, because a lot of soaps that they're going to use are going to be full of chemicals and aren't going to be pure ingredients. So make sure you're bringing your own soap for them to use that is going to be good for your baby's sensitive new skin. So after sharing with you the general hospital routine newborn care that they offer you, I want to let you know that it's really important to know that all of these things can wait, or they can be done on your chest. So having that skin to skin is super, super important during those first few moments after birth. If it can't be with you, then let them, be with your partner, skin to skin with them. And that's really going to help them, have a steadier heart rate. It's going to, help their respiratory to, calm down and steady out a little bit. It's going to help their temperature, get more balanced, being able to be skin to skin with you, as well as helping them establish that bond with you or with your partner. So all of these routine tests can pretty much done in most circumstances, can be done from your chest, or they can wait. It's nothing that is life threatening unless, you are in an emergency situation where you need that newborn care. And if that is the the case, it's good that you're at the hospital so that you can receive whatever, care you need to keep you and your baby safe. So hopefully this just kind of rough overview of usually what happens during that, time after birth with, your newborn and all that care that hospitals offer, and it helps you to decide, what's good for you, what's best for your baby, and things that you want to talk to your care provider about. So if you have any questions, make sure you comment them below. Thank you for watching this one, and I will catch you in the next video.